integrative oncology means a number of different things, but in how it's typically described is that it is supporting patients through chemotherapy, radiation, and surgery. It's giving them the natural supports to work synergistically with that and really enhance each of those therapies. And the great thing about integrative oncology is that there are so many different tools that we can use to really promote the health of the patient, to really keep the immune system strong, to really make sure they have all the nutrients that they need to really fight off the cancer. And these are all things that are very important, but they're often forgotten about in the strictly conventional cancer setting. People get so consumed in focusing on this food is good and this food is bad, and people end up developing really strict dietary plans out of fear. And if there's one thing that I've learned from working with cancer patients over these years is that the worst thing that you can eat is fear. You know, and it sounds so simple, but it's true, which is that I've seen this many times where I've had patients who had terrible diets, but they had no fear about the foods they were eating. And they actually responded way better than patients who were eating all the right foods, but they were eating it out of fear. And so you have to really change your relationship with food. You're not eating these foods because you're scared of eating the wrong thing. You're eating it because it feels like the right thing to do, because it feels like nourishment for your heart and soul, right? And that's something that really has to be emphasized. You know, I think there is a very strong connection between emotions and the development of cancer, and there's no doubt about this. And actually, I wrote an article about this many months ago, which was about the connection between childhood abuse and the development of cancer. Yeah, and really, I don't remember the exact number off the top of my head, but I believe that people who were abused as children were something like 43% more likely to develop cancer as an adult. And this was a study, it was in a very mainstream journal. I believe it was in The Oncologist is what it was in. You know, the point is that emotions are very much connected to the development of cancer. And really, when you look at what actually happens in the body when there is emotional trauma, when you're stressed, the answers are so obvious. And these are not debatable things, which is that if you are stressed, you will have a weaker immune system. We know that. This is not hypothetical. Stress makes your immune system weaker, and there are a number of very clear metabolic reasons why that is. If you have a weaker immune system, then it makes sense that your immune system would be less likely to develop, to detect rather, a developing cancer. It's very often that patients have these emotional blockages that really prevent them from moving forward, or that are holding them back from optimal healing. And sometimes when you break through some of those emotional blockages, it can really make a big difference as far as how patients respond to therapy. And I find particularly with energy work, whether it's Reiki or acupuncture, which I also consider to be a very energetic process as well, when you sometimes move the energy in the right way, it really causes a powerful movement of that emotional energy that's connected to the cancer. And some of the most profound changes that I've seen in patients it wasn't on the physical level. It was a shift on the energetic and emotional level that really triggered this massive shift in them. And it was just really obvious to everyone that knew them that shift had happened. But if I could pick one suggestion, not only for cancer, but for any therapy,
yes,
is whatever therapy that you're doing, you have to embrace that therapy as your answer to that disease. And that could be something as simple as if you're taking a supplement, whether it's a multivitamin or whatever, you're taking that pill, I would suggest that you should visualize that pill going through your body and having that desired effect. You want to have that kind of relationship with the therapy that you're doing. You're not going into a therapy fearful of side effects, you're not going into a therapy skeptical of it working. You're going into that therapy knowing that it's going to work, knowing that it's going to make a difference. That certainly applies to chemotherapy and radiation, where it can help patients to embrace those therapies, but it applies to everything else too. If you're taking an antibiotic for an infection, then visualize that antibiotic working, killing the bacteria, and not touching your healthy cells. Those are the kind of things that I think should really be encouraged, because it ultimately makes the therapies more effective.